Hello students, this is the next topic of the subject pharmacy practice, that is known as pharmacy and therapeutic committee. So this committee is very important in terms of hospital pharmacy. So it has some functions and objectives should be fulfilled by the pharmacy and therapeutic committees. So this committee control the all over the practices of hospital. So there given the contents like definition of pharmacy and therapeutic committee, objective of pharmacy and therapeutic committee, composition, then operations of pharmacy and therapeutic committee, and functions of pharmacy and therapeutic committee, and their role of pharmacists. These are the contents of the pharmacy and therapeutic committee is there. Then starting from the definition of the pharmacy and therapeutic committee. So pharmacy and therapeutic committee is a policy framing. Policy framing, you should design the strategies, policies and vision of the and future plan of the hospital, that is known as a policy framing, and recommended body to the medical staff and the administration. Both administration and medical staff should be recommended to them of the hospital on matters related to the therapeutic use of drugs. How can we use the and what is the quantity of the drug can be used, that is decided under the pharmacy and therapeutic committee is there. So here it is given the different parts of therapeutic committees, that is selection of drugs, and selection of staff parameters. Staffs is required is selected by the PTC. Acquisition, then prescription is given by the physicians, then dispensation is given by the your pharmacist, then administrator, and outcome means result of the overall function of PTC, pharmacy therapeutic committee. So what will be the outcome should be the patient should be have the relief from the hospital or from the drug, so that he can be moved to your home. So that is very important for the pharmacy therapeutic committee. Then the major are the objectives of PTC. The pharmacy and therapeutics have three major roles to play. These are known as advisory. To make the advisory means to frame the rules. They are known as advisory. Educational, you should educate the new students or new peoples, that is awareness to the society. And then safe and rational use of drugs. Safe means safety should be important depending on therapeutic index of the drug. If the dose is increased, the therapeutic index or therapeutic window will be the decrease. So that should not be happened. And rational use, rational means ethical use of the drugs should be there. So many drugs are there which can be used for the habit forming. So this type of the drug should not be used. That is known as a safe and rational use of drugs. Then composition of pharmacy therapeutic committee. So name indicates that pharmacy therapeutic committee means pharmacist role is very important here, and similarly physician's role. So here is the flow chart of the PTC committee. So first it is headed by the director of the hospital, that is known as the head of the hospital, known as the director, under which working is the secretary. Secretary is a very important part of the PTC, because secretary will control all the committee, that is known as the PTC committee. Then the director will be the head of the hospital pharmacist. Then secretary is the another important part. Then chairman is also under the dean of hospital will be there. Then under director and secretary, administrative part will be there. So the administrative part is known as the depending on the size of PTC, how much the size, that is depending on that. Then it is given by the hospital pharmacist. So hospital pharmacist always should be a registered pharmacist. Then medical staff contain minimum 3 physicians. Without 3 physicians, pharmacy therapeutic committee cannot be formed. And then a non-medical staff, that is known as a representative of nursing staff, that is in charge of nursing staff. But what we can say, actually nursing staff also under the medical staff, but it is divided under the head of physician and non-physicians, but a nursing staff also the medical known as medical staff. So this is the composition of pharmacy therapeutic committee. So all these members should be included into the pharmacy therapeutic committee. So here working is given onto the hands of physicians and the nursing staff. If physicians and nursing staff is not available, so they are very low quantities available, they cannot able to function properly the pharmacy therapeutic committee. Then subcommittees under the PTC. Subcommittees are given under the different departments. For example, department of antineoplastics or cancer drugs, department of cardiovascular drugs or heart patients. They are known as under the category of inpatient drugs. Inpatient means which is required to admit into the hospital under the supervision of doctor and a nurse. That is known as the inpatient drugs. Then psychotic drugs and GI drugs, they may be inpatient or may be outpatient, means they does not require the admission. They can also the admit to the home itself. Then anti-diabetic drugs and endocrine drugs, that is outpatient drugs. So this patient is not need to admit into the hospital. So they are the outpatients are there. They are known as the anti-diabetic drugs or endocrine drugs. So similarly, psychotic drugs and GI drugs also known as the ambulatory drugs or ambulatory patients. Ambulatory patient means the patient can be move itself without any support. That is known as the ambulatory patient. Then operations of pharmacy therapeutic committee. So operations are very important. Without operation of the committee does not have any active participation to the your hospital pharmacy. So first point is minimum 6 meetings yearly and any additional meeting whenever necessary. 6 meeting means what? Per 2 months one meeting should be there. So similarly within the 2 months one meeting is mandatory, but we can take the extra meetings. Per month meeting also will be held. So that is very important factor for the minimum 6 meetings should be mandatory. Second point, agenda and supplementary material should be prepared by the secretary and circulated to members in advance. So agenda means points to be discussed, and supplementary material, any other material should be supplied to the members, and director of the PTC should be in advance. Advance means before 3-4 days he can be circulated to the through email, soft copy or your onto the paper, so they can study that report or agenda, and similarly they can study and evaluate the agenda, and any other matter is there to discuss, so they can add into the at the time of the meeting with the permission of the chair. So that's why they should supply the material and agenda before the meeting 2-3 days. Every member must study agenda thoroughly before coming to the meeting. So every member know the agenda and they also study the agenda. If they have any problem or they have any suggestions, they should be put up into the meeting. Then all members should be present for meeting and should be actively involved in the same. So all members should have their active participation or any other suggestion should be there. So that is the motto of the pharmacy therapeutic committee, and should be actively involved to the same committee. Then a typical agenda of the meeting. Typical agenda means what are the points or what are the criteria the meeting should be go ahead. So that is known as the typical agenda of the meeting is there. So first point is known as minutes of the previous meeting. Minutes of the previous meeting means what? Before this meeting, previous meeting, what are the points are there, which point are discussed, and what points are read by the secretary, and what points can be understood by the whole meeting, and what are the reports and conclusion or outcome of the meeting. So whenever discussion into the meeting was held, so what is the outcome of the outcome of the meeting? If there is an example that they should have to build any other extra room for the patients was discussed in the previous meeting, but actually this extra room or extra material or oxygen cylinder really made available to the during this period or not. So that is the important factor, that is minutes of the previous meeting. So yeah, the type of the meeting is there. If written pages for the written material is present to the meeting, similarly physically means onto the ground what work has been done. Just putting into the agenda is not a matter. You should have the work onto the ground level or onto the your physical presence. If you take purchase the there is an agenda to purchase the oxygen cylinder, so they really purchased or not, what is the outcome? So that outcome should be also written onto the this particular meeting. So we have purchased or utilizing or not, that is very important. Second point, review of the contents of hospital formulary for the purpose of bringing it up to the date and deleting of the products not considered for the use. So many products into the pharmaceutical hospital formally really has there, which are very rarely used, 6 months or 1 yearly, or maybe obsolete or outdated, they cannot. So this type of the products or this type of the drug should be deleted immediately with the permanent cases. If it is required, they can be easily available at the time of the dosing. So this type of the hospital pharmacy content should be very important. Then information regarding new drugs which may have become the commercially available. If new drug is known by the pharmacist or doctor, so this new drug also can be made available to the hospital by the pharmacist or by the storeroom in charge. So that also is a very important factor, information regarding the new drugs. Then review and or adaptation of investigational drugs currently under the processing in the hospital. So adaptation of investigational drugs come also the under the processing for the hospital. Investigational drugs means what? Investigation means which drug able to investigate. Nowadays COVID-19 vaccine is going to investigate or going to make the clinical trials. So this type of the drugs may be possible, or this drug tests can be available to the your hospital. So many universities or hospitals make the memorandum of understanding with each other, and they able to test the drug, their drug to the volunteer into the hospital. So this type of the activity also can be held by the hospital pharmacy or under the pharmacy therapeutic committee activities. Then review of side effects, adverse drug reactions, toxic effects, drug interactions of drugs reported by the various units of the various unit means different department, GI department, psychotic department, cardiac department, diabetic department, or endocrine department. So different departments are there. So this has reported the side reactions should be to the hospital. So for that purpose separate form is there. We already studied into the chapter of ADR and drug interaction. If one patient out of the 100 patient also have the ADR reaction or drug interaction, that should be reported to the hospital. So that's why they can be easily managed to delete this particular type of drugs which can produce side effect, and alternatively another drug of the same category can be introduced into the hospital formulary. So that's why side effects or ADR or drug interaction can be minimized. So this is the end of the A part of the therapeutic committee, pharmacy therapeutic committee.